From the CBT trainee perspective, I was very keen to have an analysis as part of my training, but I've chosen to begin with having my own CBT, just to get some experience of that from the patient's perspective, and then I'll go on and have an analysis after that. I think it's just an invaluable part of being a medical psychotherapist, to have that reflective space for yourself.
The way you listen to your patients and the way you see yourself and the way, and the way you see the world around you really changes as time goes by. And I think your personal therapy really is an important part of that. It's really a very important space in my week where, yes, when I'm allowed to take a step back, or actually quite a few steps back sometimes. But anyway, but it is, it is an important space where all these things come into play. Your emotional, all the emotional experiences you have with your patients and else in life in general. All these things will inform your identity as a clinician. And I think your personal therapy is one of the places where that's allowed to come together a bit, if it makes sense.
Mm. And it's about processes that are happening every day at work anyway. And it's something about actually getting a place to explore that and to notice it, and which can be hard going sometimes, but it feels so important. And yeah, to really acknowledge this is having an impact, and how is it having an impact, and why is it having an impact, and be able to explore that and try and understand it.
Yes. I was talking to a core trainee earlier today, and they was reflecting on how many difficult experiences they had as a medical student, as a junior doctor, and how little time there is, set aside, and often there's not permission given actually to directly think about those things.
And I think there's something hugely important about having been the patient. So you know what it's like being in that other position.
Yeah.
And so you absolutely have experienced that other position that person's in. Obviously you're very different experience to them, but you know what that's like being the patient.
You can get into that place of recognising what it's like to be a patient, actually letting go of the aim of it, that you are meant to be a therapist to help, but actually get into that place of recognising, okay, this is what it's like to need help. This is all the issues it brings up. Then I think you can really engage with your patients.
Absolutely, yes, because then it's what allows you to kind of make sense of people that are struggling with very disturbed states of mind, that you end up kind of being able to empathize differently when you go through something like your personal therapy and all the other experiences that this training implies.